I've known Manish for a long time now, probably close on 10 years, and when he was around the age of 16 we started looking at transition and what would best meet his needs, and quite quickly David and I felt that a personal health budget would be very beneficial to Manish. Manish has two personal assistants that work with him now that successfully have been employed by Manish, and they do look after all of his care. So that's in terms of his overnight ventilation. They support him at night. I have supported them to be trained to the standard that is required to look after Manish safely. That's ongoing training. We meet every 6 weeks to discuss any issues that have occurred in that time, whether that be within his ventilation or any aspect of his care. But they also phone me on a regular basis about anything that they're concerned about, whether that be Manish's nutrition, his skin integrity, or just his mood and how he's managing his pain relief.
I chose Dan because he was good and gave a nice interview. He's just going to teach me poker, but he never did yet.
Delegation is a process where a trained registered nurse trains another person to do something that they would have done, so some kind of nursing care task. So for example, in a school setting, it might be far better to train a teaching assistant who is going to be doing lots of other things for a young person than training somebody who's separate, who's just doing a healthcare task. And it is tasks of the higher level, those things that you do need a very specific training for. I think what we've always understood though is that delegation is very different to training. Training is very much about delivering something to somebody as a one-off event, whereas delegation is about doing training, doing observed practice, working with somebody until they've got the skills and the competence and the confidence to undertake that task, and then offering ongoing support and retraining as required. To be able to delegate something, that has to be a predictable need. You've got to be able to put that care clearly into a protocol, and you've got to be able to train people to respond in certain ways in certain situations. Now obviously for some of our children and young people, the instability of their medical condition means that's not the case, and you need to make a judgment, or you maybe need to make a choice between a number of different things, and it's that professional judgment that turns it into something else. That's what turns it into a nursing task, and we wouldn't delegate that.
Manish has been able to be very well supported by his PAs overnight and in the day, and not only do they support him at home, but they also take Manish out. And before his PAs, he had very limited access to community activities, and that has changed dramatically now.
Yeah, he's a really good guy, and he helps a lot to go out trips, daytime or at night. Sometimes went to a comedy club. Oh yeah, we went to Man United. Yeah, we saw all the players. We're going to see Deadpool. He's a Marvel character, and he's like a anti-superhero, and just comedy and action and stuff all in one. It'd be really good.
As Manish was involved in the whole process of recruiting his staff, he was very clear on what was very valuable to him. And one of the most valuable things for him was to have some people to look after him with a sense of humour.
Come on, Dan. Come on, camera. They could blow your face out.
Hi, I'm Dan. I'm one of Manish's PAs. I usually do nights, so that would be getting Manish hoisted into bed, ventilator, feed, and just get him comfortable to sleep. And then during the night, he has like a doorbell which he presses, and that'd be if his comfort or to any issues with feed or anything like that. But I do a day or two a week as well, and we quite often go shopping, cinema.
I make sure that they do feel confident in the delegated tasks by constantly being in touch with them. They have the access to 24-hour on call. They also have my work mobile, so if there was ever anything that came up that they weren't confident about, they would be able to contact me and I would go out and assess it with them.
When I started for Manish, we started off by shadowing the NHS staff that he had previously, and also going through the NHS competencies for his ventilator, his feeds, and just general nursing. And also Manish is very good at saying what healthcare he needs as well, so he's very good at saying what he wants.
So the benefits for Manish have been that just recently when he had a hospital admission, his personal assistants were able to support him in hospital. They stayed overnight with him, which was a huge support because he felt very confident in their ability to care for him. Manish has been involved every step of the way, from writing his job description to interviewing the staff. He's also been very involved in his training with his staff. He feels a very important part of for Manish is that the people that are with him know how to look after him safely. So he also signs competencies with me to say that he's also happy that they are confident and able to care for him.
But yeah, it's going well. So my dad get a nice rest at night. And I know when Dan or Ginny's there, I always know that they're in it when I ring the bell.
In my experience, it's been a very positive experience. It's given this young man the opportunities that I don't think he would have had from any other type of package. So I definitely think that it's something that should be explored further.